As Representative Abrami mentioned, I was chair of the Department of Electrical and Computer Engineering at the time that I served on the commission. I've worked for quite a few, over 25 sponsored research programs outside of the university. I've worked for industry and government agencies like the Federal Aviation Administration. So if anything, my bias has been for technology. I'd like to point out that my purpose here in speaking, I had prepared a much larger presentation, as you can see from the number of slides. I understand that I don't have time right now to give my entire presentation, but I do ask for a bit of latitude so that I can go through the science, and I know that that's what you want to hear today. So the fundamental question that needs to be addressed is why the New Hampshire State Commission picked a setback distance of 500 meters, which is 1,640 feet. To begin, it's important to note that there is no perfect answer to this question because of the difficulty in identifying what a safe level of exposure is. It's also recognized that what is safe for one person might not be safe for another. People who are electrosensitive can experience symptoms of radiation exposure at distances greater than 1,640 feet, which means that the proposed setback may not ensure a reasonable exposure level for the electrosensitive population. Electrosensitivity is real, and it's recognized with the Americans for Disabilities Act and Medicare. Different people have different sensitivities to radiation exposure, just as they have different sensitivities to sun exposure, foods, such as peanuts and bee stings. I mean, my wife can go out in the sun for all day practically and not get burned. I can go out for half an hour and I get burned, and it's the same thing with electrosensitivity. So there are indications that the number of people with electrosensitivity will be increasing over time because the background levels of radiation that we're all exposed to, that's rising. Every time you add a new facility, a new antenna, your background level of radiation, just like smog, as you increase the levels of smog, the incidence of diseases associated with smog increase. The same thing is true for background radiation. So a goal of the commission in establishing a setback was to provide reasonable protections for the majority of people while not impeding the use of wireless communication. When using their own wireless devices, citizens can maintain control of how much radiation exposure they receive. Those wireless devices include their own cell phones, cordless phones, wireless appliances such as printers and baby monitors, and people have the option of turning these devices off if they do not wish to be exposed. However, they are not able to turn off a nearby cell tower if they want to reduce their radiation exposure.
1 minute, please.
I'm not going to touch anything. So I asked for latitude.
You are, but you're wasting time by explaining, so keep on going.
Well, all right, fair enough. So we're going to look at the reasonable. To determine I'll go right into it, but it's not going to be 1 minute. So if you,
you're wasting another 30 seconds, so please continue.
Fair enough. One approach is to look at the adverse effects as a function of distance people live from a cell tower transmitter. By tracking adverse health effects and determining how they relate to the distance people live from cell towers, you can get a sense of where the exposure risk becomes reasonable. There have been at least 10 studies that have done this, and I will be referencing one of them in the next few slides. You have those in front of you. Using these epidemiological studies was one approach that we used to determine setback distance. And I will go right to that one. I'm going to be talking only about that one study that's in front of you. There have been at least 10 studies, though, that have looked at these adverse health effects, and 8 of the 10 found the exposure and identified the 500 meters that I'm going to be talking about now. So what you're looking at in front of you right now is a study from Brazil. And the reason I'm using it is because it demonstrates so clearly the relationship that we're trying to find. And that is how far, at what distance do you no longer experiencing severe or significant adverse health effects? So one important aspect of the Brazilian study is that it took place between 1996 and 2006. And the reason this is important is because a lot of people didn't have cell phones in Brazil at this time. This is a question that was asked earlier, is what is the effect of the cell tower? What is the effect of your own cell tower or a nearby cell tower? So after about 5 years after the study, only 28% of the people in the region had cell phones. So what the study that you're looking at right now is basically only the effects of living near a cell tower and not your own devices. What's important also in this study is that it looked at a large number of people, over 7,000 deaths, for people living near over 800 cell towers. And these, of course, is a large number of people, give you statistical significance, so we have confidence in the results you're looking at the chart. So the takeaway from that study, and I'm going quickly as I can here, is
Please sum it up, please.
at slide 7. So the plot you see in the handout shows the death rate from cancer as a function of the distance people live from a cell tower. The red trace is for the population in general. The fact that that red and the blue trace is for the population in general, and the red trace is for the people in the study. As you look at that plot, you can see that the incidence rate of cancer declines for people living away from the cell tower. And as you get far enough away, of course, the incidence of cancer goes to the same incidence rate as for the population in general. But if you look at 500 meters, you can say, yes, there is a decline in cancer rate, a significant decline. That's where you tend to have a break point in the slope of that curve. But that is what we identified as being a safe, not a safe, as a reasonable setback distance for
Mr. Chamberlain, please, your time has expired. Thank you for testimony. I've given you twice as much time as what was originally reported.
I appreciate
Thank
that.
you very much.
Thank you.
May I remind before I go into questions, may I remind anyone here, if you have written testimony, it is far quicker to just summarize the bullet points on your written testimony than to read them. Just pass it to our committee and we can read it later. This will save time and get right to the point. Thank you very much. Anybody have questions here from the committee? Representative Harrington, you're recognized for a question.
Thank you, Mr. Chairman. Thank you for taking my question. This sort of follow up from the previous discussions there. You put out, I'm looking at your chart with the 500 meters being sort of the break point where the curve starts to level off. And there is not a huge degree of savings or health factors when you go beyond that distance. But based on what we've talked about before, would you agree, or maybe you know more about 5G than I do, which you probably do, is it even possible to implement 5G given that 500 meters and, you know, the population density of New Hampshire it's not New York City, but there's not a hell of a lot of places where there's no one around for 500 meters.
You know, you raise a good point. The reason we went with 5G towers as well is that there is no real defined 5G. 5G can use the same frequencies, and oftentimes does use the same frequencies as are used for 3G and 4G. So in other words, they could take one of these small towers, the small cells that you've heard about, perhaps the one you're referring to, and put in a transmitter that transmits at the same frequencies as today. So we felt that we didn't want to have those same signals being radiated from an even closer distance. So that's why we included the 5G towers in the setback. Now later on, perhaps there can be other rules that can be put in place, but right now we didn't feel that was the case. We wanted to get something in place to protect the public.
A follow-up, Mr. Chairman?
One follow-up, go ahead.
Really quick. So just to get down to the point here, do you agree that the 500-meter setback would basically eliminate the implementation of 5G technology in New Hampshire?
No, because there is no defined 5G technology. 5G can use the same frequencies. They can call it 5G, it uses the same frequencies that we have now, and it works just fine. So it doesn't prohibit it. It prohibits it from using maybe some of the higher frequencies that attenuate more rapidly with propagation. But no, you can have 5G with the frequencies that we have today.
Chair recognizes Representative Kelly Pitts for a question.
Thank you, Professor. I'm going to pretend I'm in class now. Do we have any data on how much radiation each of us is exposed to every day and how much more this new technology would add to it? So if we're having problems now, it's from the technology we're using now. So do you have any of that hard data?
Yeah, we do. There are studies that are making measurements in various cities, and the results are, as I suggested earlier, is that you look at your background levels of radiation and they're steadily going up. Just as if you have, and I mentioned this earlier, that if you have air pollution, as that increases, the incidence of asthma cases increases also. So yes, we have definitive data that shows that the background levels of radiation from all of electronics, from all radiation sources, is increasing. And there's actually been correlations done on, just correlations, on the level of radiation, of background level radiation and health. And it is a negative correlation. So the more radiation you have, the more likely people are to be sick, because it does suppress, and we have data that show that exposure to radiation depresses your immune system.
Follow-up, go ahead.
My follow-up would be, is this new technology that they purport to bring on going to increase dramatically that level of radiation?
My understanding is yes, that if you look at cities, and this has been a study by Dr. Marga Havas, that if you go to cities that have 5G, their background level of radiation is statistically significantly higher. Yes.
Thank you.
Seeing no further questions, thank you, Mr. Chamberlain. Excellent presentation.
Thank you for your time.